Good morning. Welcome to our 93rd Coffee with the Commissioner event. It's 6:30 a.m. It's early, but there's a lot to talk about, and we've got a great panel this morning to have some really important discussions about some great things happening in the community. As always, we've got Wes Marino here. Good morning, Wes.
Hey, good morning, Commissioner.
And we've got Eric Gilmore here, who's going to talk about public safety. And then our special guest today is Allison Hill. She's the CEO of the LifeView Group, formerly Lakeview Center. I can't wait to talk to her about our central receiving facility and all the great things that they're doing to assist our hospitals and assist our folks who have mental health issues in the community. So lots of important discussions going to happen. But Wes, I know you have to jump off a little bit early this morning to go and speak on another show. So we'll let you kick it off with some updates from the county. Thank you for being here.
Yeah. Hey, good morning, everybody. Hey, one of our biggest things is everybody should know is we have a balanced budget. We presented a balanced budget to the board in July. It's about $748.6 million, about $30 million over last year. I would say we have leveled out this year, though, in our personnel costs. We did level out like we said we would. We will continue to do that. And one of the biggest things in this budget you'll see is our reserves are back up to about $39 million. And a couple of years ago, well, about 3 or 4 years ago, they were only 20 million. So it's we've made a lot of progress there. We're about 10% increase above over last year's ad valorem. However, we've not raised the millage rate. That's just simply in property values. So we're proud of that. And fire is fully funded. We still, as we move forward into this next year, I think one of our challenges will be to find an alternative funding source to assist with some of the fire costs. I think we can do that and accomplish that, and that'll be a big deal. Other than that, operationally, we're doing very well. All of our departments are doing really well. Met with the directors last Friday. It seems to be a good sense of morale throughout the county. We've been doing hamburgers and hot dog cookouts all over the county, interacting with employees. Of course, they all love those, and that's great. And then the past couple of months, we've been on a ribbon cutting tour there in District 1.
Yes.
We've a lot of work's been going on. It kind of sneaks up on you. I know we found the Chips yesterday. He goes, some of these projects have been 4, 5, 6 years in the makings, and we're landing the plane on quite a few of them all at one time, which is great. It's great for the citizens. It's great to go out and interact. And we had a ribbon cutting yesterday at Perdita Key, just a great crowd out there, very positive environment, a good amenity in the walking path. People were using it yesterday. It was hot, but they were still out there walking and running and bicycling, doing a good thing. We opened the Beulah Firehouse, which was a big deal the week before. Perdita Bay Boat Ramp, that's another big amenity there in District 1. But we had the Pine Valley Estates and French's Heights drainage. You had Barefoot drainage project going on that we've cut ribbons on, and the new bridge on Longleaf, we opened the ribbon on that. And the unique thing about that project was we started the day after school ended.
Right.
We opened it up the day before school started back.
I remember that.
That was a big deal. And we're doing a good sidewalk and drainage project there. We're at Nathan and Longleaf. That'll be a good improvement for those folks on Nathan Drive. It's been a big concern and a long time coming. Just a lot of good work. Resurfacing in Perdita Bay Country Club Estates was a big deal. Much needed. It's a large subdivision there, and it's a great improvement there. But just throughout the county, just your everyday public work stuff that calls in, hey, fix my driveway, or there's trash over here, the right of way is overgrown here. Those guys are always out in the middle of everything. We've been fortunate with our weather so far this year. We have had a few rain events, but we're always there on top of things, ready to go. Engineering is cranking out work like you wouldn't believe, and purchasing is still cranking work out. We'll set a record this year for the number of solicitations that we put out again. So every year we're building a little more and a little more. Purchase is doing fantastic. Our procurement group has been asked to come and do presentations as to all the improvements we've made and how to streamline your processes and how to get more work out the door. So from where we were to where we are there, it's been just great, night and day, and we're proud of that. Just proud of all the staff in the county. They work hard. All these projects couldn't come to fruition without the staff. All the work that goes on unseen sometimes in development services and parks. Oh my gosh, Michael Rhodes is just knocking it out of the park. He's doing a fantastic job, him and his leadership over there, keeping the parks up, all the new amenities, all the new soccer and agreements with the SEC, and just a lot of work going on there that goes unseen, but you see the fruition of it with people coming into Escambia County, and just a lot of good things going on. I just can't say enough good about everything that's going on in the county. People ask me all the time, "How you doing?" I said, "We're doing great." I said, "Regardless of what you might read here and there, we're really doing good." I said,
Exactly.
you can't let 15 or 20 people create the narrative. You know, we're doing fantastically well."
That's so true. Hey, Wes, I was asked yesterday a question about the various departments and which ones I felt were doing fantastic, which ones might have needed a little bit of maybe a prod here and there. But I know in a specific, the engineering group, I know they have really turned it around. I mean, they are putting work out. I mean, getting projects done. They're going to redesign the roundabout for us. They're doing Don Carlos, Gongora, River Road over there in Perdido. That's going to be a big leveling and resurfacing project. But the other group that I think are just doing fantastic, like you've mentioned, procurement, our purchasing office, and our human resources division. We've got new managers on both in both branches, right? And tell me if I'm wrong, but didn't we put out like 100 million in work last year with these guys? The way they've supercharged purchasing
Yeah, we put over $100 million worth of actual construction on the street
on the
last year.
street.
And that doesn't include design, that's construction. So you
Wow.
can add the design to that. And that's what I'm saying. You got folks driving work, and I know that sometimes they go home tired and they lay awake at night thinking about what's coming next. And we pull in a lot of grant money.
Yes.
We
Yes.
pull in grant money every year. We've been doing this for years, but it seemed like lately the grant opportunities have really exploded. $21 million worth of a grant for ECAT. I mean, unheard of. We used to
That's awesome.
used to never got looked at ECAT, and so we're
Right.
making a name for ourselves there. But along with the grant money comes all the reporting. You got to report, you got to track, your procurement has to include certain things in the procurement process, depending on where the grant's coming from, and it's a lot of work. It is
Yeah.
really a lot of work. And we've brought a lady on board with us, Tammy Plant, who's helping us out there. She's working with Liz Kissel. They're there to help us with our grant procurements and our tracking and our reporting. We've got a new grant software that helps us look for grants. We can type in what area, if it's infrastructure, water quality, transportation, whatever it may be, we can type it in and a list of opportunities will populate and we'll go
Hey,
through
Wes,
those.
what is that software type? Do you know
It's
offhand?
called eCivis.
eCivis. Huh.
eCivis. Yep.
That's
And
pretty
then
neat.
on top of helping us search for grants, it also helps us track the grants. We can create a project in that system. It helps us track our milestones. Then at the end of the year, you can create a report and we'll know just exactly how much grant dollars we brought in. But I would say we bring in $100 million worth of grants almost every year. And it's just,
Yeah, that's amazing. That's
yeah, I
incredible.
mean, well, it's what we've been doing this for years. Chips Kirstenfield, there's no telling how many gazillions of dollars he's brought
Right.
into the county throughout his career, just by
And
chasing
also
grants.
the estuary program too, you stand alone, they're
Absolutely.
bringing in grants as well. So
Yep.
Matt Posner's doing a great job over there. And the final thing is human resources. I know for a while there, coming out of COVID, we had a lot of vacancies. We had like 500, maybe 550 vacancies. I know the human resources department, people, the directors, the department heads have been hiring, recruiting. We've made quite a dent in that number, haven't we? I mean, where are we at now? Just
Yeah, we had, we were 500 down easy. We're probably still about 200 down, I would say.
okay.
Roughly,
So we've made good
it's an
progress.
ebb and flow. Public Works will be full today, and then you'll lose 3 tomorrow. But it's getting a lot easier to backfill some of
Right.
those positions. I will say that. Corrections, we still have some positions. They're there, but we've kind of defunded them. We're still going along there. Seem to be
Mhm.
operating just fine by utilizing that strategy. But yeah, we made Nikki Powell and the team that she's built there in HR are just phenomenal. Actually, they're kicking off some supervisor training this morning at 8 o'clock. Our
Oh,
first
okay.
round of supervisor training, which is much needed here in Escambia County, and well, any organization for that matter. But
Yeah.
so she's been proactive in putting all that work together and built a good team, and just doing really well for us there in HR.
Hey, Wes, one last question. And I know we gotta move on, but so are the tax roll, it increased again this year. There's a lot of speculation, what's going on in the economy, the interest rates. I mean, just a lot of concern with the big national election. Do we have any sense from Chris Jones and Bubba Peters of what they think next year's? Because I mean, once we complete this budget, we roll in and we start working on the next one.
Right. Right.
Was there any sense of where that's going to be next year? Have they spoken to you,
Not a
Stephanie?
strong sense. This year we thought we were going to be closer to 7%. We wound up being at 10%. They give us an estimate usually around June, end of June, start of 1st of July. but as time moves, as you move through July, that estimate comes a little more clearer, a little more solid. I will say this: when we had our meeting last Friday, Tim Tolbert said, you know, our residential construction is slowing down some. They're still really busy, but the residential single family is as far as construction is slowing down. So I would use that as a barometer to say that, you know, it'll probably be a little lower than this year, just based on what we're seeing there.
And speaking with some real estate agents, you know, the interest rates, you know, hovering around 7%, they really want to see that go down a couple points to 5%, because it does. I mean, that really is a barrier to some people being able to buy a nice house or even a first house. So, and then I've also noticed, you know, if you watch the real estate listings, the prices are coming down, which concerns me. I mean, obviously that's good if you're trying to afford your first home, but if we're looking at the overall tax roll and wanting to keep that moving forward, just a concern. So just was wondering. I appreciate it. I know that was kind of out of left field question for you, but just was curious.
We're already thinking on it. Me and Stephanie have been talking about
I know you are. Outstanding. Well, hey, Wes, thanks for being on, man. I know you got to rock and roll. Thanks again for yesterday. That was a great day, and all the hard work from staff. The boat launch was fantastic. The fire station opening was great. The hard work on the property transfer from the Navy over there on Bower, that's going to be a great project once we get it going. So thanks for all your hard work, and we will see you a week from tomorrow, right, for our August meeting.
Absolutely.
All right. You have a great day.
Thank you.
All right. Eric, you're up, man.
All right.
How are things going? How are things going in public safety? How are we doing?
Public safety is busy. Of course, we're always busy. So I'll highlight some of the key things that we've done since we've last talked. Of course, we just come off the heels of the Blue Angel Air Show, which is a heavy lift or a big push for us guys here, for men and women here in public safety. I don't think anybody really knows. When they go to the beach, they see the blues flies, but they have no idea what all entails to make that as smooth and as safe as possible for the public out there. Right. I mean, from logistics to our EMS tent being set up for triage, to San Jose Island Authority and the Visitor Center doing a cooling station, to Thor setup, to we got traffic engineers sitting in Thor watching red light cameras to try to make the 98 and everything run smooth. FWC, law enforcement, those guys, traffic. So it is a big thing that we do every year. And, you know, we're glad those 3 days are over so we can focus on something else. But it was successful. This air show went great for 3 days, even to our beach lifeguards as well. I mean, and our dispatchers. Like I said, it's all hands on deck on that thing, but a lot of people don't know behind the scenes what really goes on. So I just want to shout out to those crews out there and the men and women who did that, and along with CERT and the volunteers who came out and handed out bottles of water. So like I said, it's a great event. It's a great exercise for us all to get together and practice our communications and how we interact with each other. So,
and I heard anecdotally from Sheriff Simmons that you know, he only had to make a small number of less than a handful of arrests, which seems to me to be incredible. I mean, people were well behaved.
No, I mean, so we didn't see the amount of heat exhaustion due to alcohol that we have seen in the past. So I appreciate the public going out there and taking care of themselves, one, to enjoy the show. Maybe they've been listening to the message or they get it now, but we didn't see as many people in the tent we've seen in the past. So I think we only transported 12 people total all 3 days. So that's much better than what we've done in the past. So yeah, I do appreciate the public coming out and being responsible. So that helps us out as well. So anyway, so that was one thing we did get done. You mentioned the Beulah Fire Station. That was exciting. We did the ribbon cutting on that. We do have a 24-hour crew out there in Beulah as it stands right now. And all they'll do is when we get these certificate of occupancy, we'll just transition, move the guys right into the new station. We won't miss a beat and we'll be good to go. So, and they're excited to move in. It's a nice facility for those who are out there. And if you hadn't seen it, it's kind of hard to see. It's kind of tucked in the back, but it is a really nice facility. Something to be proud to work out of, and something to be proud to say that look what this community has. So
yes, and it was a long time coming, Eric. I mean, it took a lot of coordination. And for me, I think probably the most stirring aspect of that dedication, of that ribbon cutting, was having the family of Dwayne Bradshaw there, and that really meant a lot to me, having Steve McNair there, and to be able to speak and see a legacy to his work in that community. It's really great when we can do things like that and honor the men who really sacrificed their entire lives literally in the case of Dwayne Bradshaw, and then figuratively for the decades that Steve McNair gave. So yeah, that's a great facility. I am walking through. I am concerned about the punch list. I'm going to be going back out there. It seems like there's some issues, but hopefully Rob Hogan and his team can be right on top of that. But it is a beautiful facility, and the guys that work there, I'm certain that they will really appreciate it.
Oh, absolutely. So, and Rob updated me yesterday. I think all the inspections have been done, electrical, mechanical, plumbing. I think they're the last thing is the fire systems. So they're getting the inspection for the fire systems done. He's estimating within 2 weeks we can start looking at doing something. So the doors won't be there, but that's fine. But we can move in and occupy it and then get things going. So
what is the latest on the doors? I have been getting pilloried over the head, even though I'm not involved. You know, people don't get it. They go online and they think, you know, that I'm run the world. If an asteroid comes too close, it's Jeff Bergosh's. I mean, I'm being, you know, facetious, but they think it's my fault the doors didn't come, that I picked
you
the
were
doors.
building them. I thought you were building them, right?
Yeah, you would think. I mean, if I was building them, they'd be done. See, that's the difference. If I'm close something, we get it done.
He's saying what he told me yesterday was the latest is pushed back to mid-August. There'll be import in mid-August. He has a delivery date in a port mid-August.
Okay, can we run that fire station with those temporary doors like that?
Yes, we could do that.
Okay.
That's so. But those temporary doors we can make that happen. So
yeah,
we'll work.
They don't look as good as the other ones.
It's not aesthetically pleasing, but it is what it is.
Functional.
So we'll make it. It's functional. So anyway, no. So another thing that we've had, as you mentioned earlier, was the Barrow Road, the Barrow Road Fire Station with the land acquisition from the Navy. That's exciting. So we can start moving forward with the Barrow Road Station out there at Paradise Beach, which will help the ISO and the people out there in Paradise Beach. So we're looking forward to moving down the road with that one now that we have land acquired that we can do something with and put something out there. I do want to remind everybody before I get into anything else, we are in hurricane season. I do want to do a plug for EM. So I know we've only had 3 storms and everybody was touting it's going to be above normal season. But it hasn't shown that way yet with only 3 storms. Remember, one of them was a major hurricane. We've never had a major hurricane this early in the Atlantic season. And it takes 1 storm, folks. So please make sure your preparations are taken care of and that right now's the time. Every time you buy groceries during the week, get a couple of cans of Beanie Weenies, get a couple of a case of water. You need 1 gallon of water per person per day. Make sure you're getting those essentials, your prescriptions, anything for your pets and animals and for your kids. And you're elderly, so make sure you're taking care of those things. So I just want to do a plug real quick because I don't want anybody to get complacent because they hadn't heard anything. And it was ramping up to go pretty quick, and now we just kind of lulled. So I don't want complacency to kick in. So,
well, and if everyone remembers, it was a late season storm a couple of years back, Michael. I mean, that thing turned into a monster. I remember looking at the aerials of Mexico Beach, a place in my youth I used to go, and it was sad. I mean, that thing was demolished. And frankly, I mean, I was quite surprised there wasn't a greater loss of life because they weren't exactly sure where it was going to go. And I'm sure a lot of people hung in there. And boy, but I mean, like matchsticks, it was just wiped out.
Well, the intensity caught them off guard. It wasn't supposed to intensify to a Category 5. It was supposed to be a tropical storm when it came in, right? Everybody was like, it's going to be a tropical storm. Well, this thing rapidly intensified, and that really got everybody behind the ball and caught them really off guard. So we don't want that to happen here. So we'll be messaging, communicating. And while the predictions are good, and when I say predictions, I'm talking about landfall predictions, they still haven't gotten pinpoint on the intensification. So, I mean, remember Sally, right? It was a meandering depression out there that it had no steering currents and wasn't going to build anything, and it built to a strong Cat 2. So,
I actually had the opportunity to go to the governor's hurricane conference, and Dr. Brennan was there, and he talked about this is the biggest concern they have. They've got the 72-hour, the 5-day. They've really got those spaghetti models down very, very well, but it's that intensification. And they use that, the storm in the Pacific that went into Acapulco, and the way that it just went from nothing to a Category 5 in like 60 hours. It's like, boom. That's what the worry is. Something like that in the Keys start spinning up. And if it hit Miami so we've got the intensification, the rapid intensification. I mean,
yes, absolutely.
What can you do about that?
So once something pops or something looks like modeling down the road, we really keep an eye on it, and we start having earlier discussion than what we've had before because of the possibility of that. So we do meet with our community partners earlier and have a plan in place. That way we're not behind the ball pulling trigger points. So.
Right. Let me ask you, we were out at the beach. I know did you have Thor out there at the beach?
Yes, so we did have Thor out there at the Blue Angels Air Show. So Thor sets up right there at Santa Rosa Island Authority,
Okay.
and inside Thor is all your command elements to what we operate in the Blue Angel Air Show. And I'm talking about from every agency you can think of is in there. You got law enforcement, you've got the FBI, you got the Coast Guard, you got of course public safety, fire, EMS, emergency management. You got Santa Rosa Island Authority sitting there. Anybody who needs to make a decision for their agency during that event is sitting in Thor so they can communicate that out to their people in the field. So that's how we do that. That's our central hub of information that flows in, and then it flows out through Thor as well. So that's how we do that.
That's a great asset that our county has. And I know that in a number of instances, we've utilized that and we've deployed it to other jurisdictions to help them. I think, didn't we deploy it to South Florida when the tower fell down, when that condo collapsed?
Surfside. It stayed in Surfside, down in Miami, down in South Florida for, I believe, 3 weeks. So it did stay down there as a command post on site. Most recently, a lot of people don't realize, is we sent Thor to Oklahoma for the tornadoes.
I didn't know that. No.
Yes, sir. So
That's
Thor went to Oklahoma for the tornadoes to assist the state incident management team to go up there and help those people recover from the tornadoes up there.
Wow.
Just it was north of Oklahoma City. So, oh, I'm sorry. Yeah, it was in Oklahoma and in the Pawhuska area. So anyway.
Interesting. Huh.
Well, Osage County is where they were. So anyway.
What was it? Osage?
Osage County.
Oh, okay. I think they made a movie about that. The ambulance. I know it's completed. Is it? Did we take that out to the beach too, or
we did
no?
not take that out to the beach because we have a footprint that allows only for so much equipment out there. Mm-hmm. But we had the tent, so we have a cooling tent that has, I think, if I remember correctly, somewhere around 20 bays. So we could put 20 people in there with 4 air conditioners going, and we do cots in each of the bays. So the ambu bus is for major transportation. So if I had a major incident, then we throw a bunch of people on it and get it out of there. So we decided this time not to put it out there. We was going to put it out there as a static display, but we didn't. We wound up putting one of our ambulances, the newer ambulances, out there for a static display. We felt like we had enough ambulance for transport on site that we could just hold in triage or hold in the tent and take care of those people. So we're looking down the road, possibly bringing that out there. It just got wrapped. It's not 100% done. We got a couple of more things, equipment to add to it and mount to the bus, but it can be utilized. If I had a skilled nurse facility or something that needed decompressing right now, we can take that thing over there, load them up on it, and move them down the road. So it is available to use, and it is, if we need it right now during, God forbid, anything during hurricane season where we need to decompress a healthcare facility, we can do that.
And it's over at public safety if I want to come walk on
it. It's public safety.
Okay,
yes.
Cool. Yeah, that's a neat asset. Not every county has that, so it's good to know that we have that in the back. Final thing before we move to Allison. And Allison, thank you for your patience of being here. I really appreciate you. Obviously, staffing in EMS, staffing in fire. I know the challenges. It's one of the things that we are, take a lot of grief for. The wait times, the hold times, things like that. So, how are we looking on staffing for EMS in the specific paramedics and EMTs?
We are looking better for staffing. So we have 2 paramedics that just onboarded with us. And when I say onboarded, I mean, we just put them through the HR process. Everybody needs to understand that if I bring a new paramedic on or a new EMT on, even a new firefighter, they're not immediately going to the field and operating. So they've got about a month of training and orientation for our policies, our SOGs, and do some ride-alongs with field training officers to make sure they're equipped and understand what our policies are, and then turn them loose out there. So it is still an arduous process of getting a new person on the road by themselves. It does take some time. But as far as EMTs, we're really good on EMTs. We still have some vacancies in paramedic. I think we're under 10 is last I heard, 10 vacancies. So we're doing heavy recruiting. We do have the $5,000 bonus over a 3-year period to try to entice some people to come on board. And I know there's criticism about that, but I mean, $5,000 is still $5,000. So we are, we're doing a lot of good things here. We're doing a lot of things to talk to the employees. We want to make this a benchmark place. And to do that, we need employee buy-in, and we're trying to get that. We want the employees to feel like this is a good place to work. This is where they want to come. I don't want anybody to ever feel, God, I got to go to work today. I don't do that. I enjoy coming to work because, one, you never know what's going to happen. So it's day to day. Two, I like the people we work with, and we do have we have a professional group here at Public Safety, from the fire side, EMS, all of my divisions, communications, lifeguards, emergency management, everybody. But we're working on those things. Fire side, we did hire a huge cadre of cadets that are going to be going through their Fire One program. And then we'll have those guys out there in the streets and on the trucks after they get done with their Fire One certifications. And that takes usually around 4 to 6 months. We can do it. We're trying to do it in a quicker process by doing our own academy and not have to rely on somebody else. So if we do that, we can shorten that time frame down once a new person comes on board, and then they get their fire training, standards training, and then out in the field. So, but we did get the blessing from the Florida Fire College to do our own in-house training program. So it's exciting. So we'll be doing that. We're working with the city on their drill tower to occupy that, because we need a drill tower facility until ours gets built up on Camp Strand, and we're working on that one as well. Then we'll transition to our training facility and get things done. So,
and the medical direction on the EMS side, we're still contracting that out, or do we have?
That's correct. We have a contracted is Dr. Josh Gordon. He was previously with UF Healthcare.
Okay.
With our UF contract, and then when UF decided to cut the contract, Dr. Gordon stayed on with us, and we contracted solely with him using US protocols and everything that we already had in place. So it was just a seamless transition.
So the protocols, have they all been updated? I know we were at like 60 or 70%. Are all the protocols updated?
They're updated, and they're being rolled out each in-service. So we're on the last few to get out there. The major ones have been updated and got out there. The rest of them are as the in-services, and we got another in-service in August to roll some more out. So yes, sir.
And, a lot of folks, they ask about this, and I've been told, and you can tell me if this is true, but I've been told that, due to the nature of the work, obviously there's a high burnout rate, and some departments, you will have a complete turnover of your staff every 3 years. Have you heard that about EMS divisions?
On the national average, yes, there is a turnover in about 3 years, and it is. And we run a lot of calls. I mean, when you get 70,000 calls for service, and then we're around low 60s for transport, actually transporting those people, that's a lot of calls in a 12-hour shift. To combat that and try not to fatigue the employees is important to us to get staff on board, get more staff on board, which in turn puts more trucks on the road, which in turn reduces your unit hour utilization and your call load for your 12-hour shift. So that's imperative. That's why it's important to get the buy-in from the employees. I mean, you got to go work for an organization. You're going to talk to some of the employees first, right? And if they're bad-mouthing the organization, then you go, I don't know. If they're going, hey, no, it's a good place to work. Yeah, it does have its faults. It's got some hiccups, but everybody does. But here are the positives, and and that's why that employee buy-in is going to be important for us.
And the final question I'll ask you: the blue ambulance trucks. I know we had some issues. We had a couple of lemons in the batch. Where are we at on is it 6 or 7 of those that we purchased?
We purchased 8 of those, sir.
8 of them.
8 of them have been purchased. They all did get shipped back to either Ohio or South Florida because we didn't accept the work. It was below subpar work, honestly. And that's not so. You're paying that big a price tag. You want it right. So
yeah, absolutely.
We tried with the techs coming in town and working on them and turning them out. They didn't have a good shop. They didn't have a good enough shop. They had all these excuses. So load them up, ship them back to the factory, fix them, get them right. So they worked on all the punch lists. Now, as they come back and then we run them, we're finding a couple of little things here and there that are not major, but they are on the road. Not all of them are on the road yet. They're still training some of the crews because it is a new truck. It is a different animal than what they've been driving with the internationals. So they have to go through an EVOC refresher with that vehicle. So we're getting those things turned out on the road. We have several on the road right now that you can see around town from time to time.
Yeah, I've seen a couple. So do we get them all? Are they all back from the factory in Ohio and Miami?
I know 6 was back. I think we got the last 2 back last week, if I'm not mistaken.
Fantastic. So okay.
Yes, sir.
Sorry to hit you with all those questions, but these are the things I get beat up on Facebook.
Core real quick. Did you want to just run down core? Because it's a good
segue for Allison. Oh my gosh. Yes.
So our core program, which was funded by the state of Florida and rolled out by Governor DeSantis to fight opioid usage. So we've been running just a little over a year. And I give some numbers here. And as of early this month, we had 641 people that we've encountered. Now that's people who have questioned the program, asked about the resources, what's going on. That's 641 people. Now of those 641 people, 136 individuals have taken us up on the offer of help.
Okay, let me ask that because I remember when Chief Torcell was with us, and I saw him give a presentation, and one of the questions that was asked, and I thought it was really, really salient question was, when these folks overdose and they're saved with Narcan or brought to the hospital and saved, one of the things he said was, part of CORE is we've got to engage these people before they leave the hospital. We got to, once they get out of the crisis mode, we've got to get them. That 136 people, are those folks who have overdosed, or are these just curious people that are drug users? I mean,
it's a mixture. It's a mixture. So some of it is people who have overdosed that we've encountered. So our core team is comprised of nurses, and they're separate from the EMS side. So what they have a radio, and if they have an overdose, they do try to meet that patient at the hospital. Now the hospitals helped us do induction as well. So the hospitals give them information as well. So if they get somebody who coming off the street, because not everybody calls 911 for an ambulance. Right. Well, I wish everybody did call 911 for an ambulance for some of the things that they did, such as last night. But anyway, the hospitals help us do some induction. Our core nurses are listening to the radio and go, okay, that's a possible person right there we need to go make contact with. Let them go to the hospital, get treatment, and then we'll follow up with them and call them and say, hey, we understand you had this episode, life-changing event or something that happened. You're like, here's what we offer, and try to get them on board. So it's a mixture. Sometimes it's the parents calling us and saying, I need help for my child, which is great. Any way we can get the person, we'll get them, whether it's a referral, whether it's them themselves, or it's our nurses being proactive and going out there and meeting them in the field after an overdose and trying to tell them this is a program that you can get into.
Are they engaging the homeless community? We've got about a third of them, who, frankly, they're there and they just want to be there. They're quite content. You got a third that are probably undiagnosed, untreated mental illness. I'm going to ask Allison about that. And then you got another third that they have they're just drug addicts. And I mean, are the core nurses engaging?
They go to Beggs Lane quite frequently. They go to those other frequent camps. Some of our people, some of our inductees are homeless, and Allison can attest to that because she is dealing with that. So I told you we had 136 that we inducted. That means people who wanted to get in the program, who wanted to go through a cleaning, get better. Of the 136, we have 115 that we have transitioned on for further care, that transitional care to Lakeview Center, which is our partner that takes on, we do the warm handoff to those folks over at Lakeview, and then they pick up the service from there. So we have an 85% success rate of people who wanted help that we've turned over to Lakeview for long-term care.
Wow, that's impressive. Let me ask about insurance implications. These folks, if they have insurance, if they don't have insurance, does that determine the level of care that they will get?
No, not whatsoever. It's the same level of care for everybody. For us, as I said, the program was funded solely by the state. Unfortunately, the state has cut back on our funding this year. They're reducing us to 75% funding. And the following year, they'll reduce us back to 50% funding. And then from there on, we got to find sustainability, which we have with the Opioid Abatement Committee.
I was just going to say,
the Opioid Abatement Committee is filling the other 25% gap for us this year, the 50 next year, and going forward. As long as we keep producing these metrics and we keep getting these numbers and we keep doing aggressive recruitment to people in our program, I think it's something viable to do. The Opioid Abatement Committee sees it as good. It's a good program. It's viable. And the more people we get cleaned up and get off drug, it reduces our 911 calls. It reduces a burden on the healthcare system. Overall, it's a burden off the taxpayer as well.
Hey, and let's talk about the opioid overdose rate. I keep hearing anecdotally and in the news that it's leveling off, or may even be coming down a little bit. But I'm also hearing this disturbing thing about this new powerful thing called Tranq. And I guess it takes 3 or 4 Narcan doses. Are we seeing that heavy duty stuff here locally that you can't revive them with the Narcan up the nose?
We have seen it. Yes, we have seen it. It's not prevalent, but we have seen it. Yes. And it is so strong that Narcan won't turn it around. Sometimes, in some cases, it won't turn it around at all. It is a blocker to the Narcan, is what it is.
What is the other stuff that's out there now that's even stronger than Narcan? I've heard that there's another. I'm not 100% familiar with that, and I don't know if it overcomes that as well. Maybe Allison can speak to that. But Allison, are you aware of? Have you heard of that other? It's a weird name with X's in it. Axolotl. It's like super Narcan. Have you heard of it?
We have, heard of it. But, Narcan is still effective. And in any situation, like Eric described, where a person is overdosing, I wouldn't worry about whether you have that new drug or Narcan. I would just administer what you have. We still have access. And I think, Eric, you guys do too, to Narcan, and are making it available.
That's correct.
At no cost to individuals, groups, whoever needs it. So we're still distributing Narcan that we get through the state. But just like the illegal drugs continue to, people continue to source the high, the drugs to kind of fight the effect of that also continue to improve. So we're gonna always see that. Jeff,
well, Allison, that's a pretty good segue into what you guys are doing, and I know that we have a drug addiction issue in the community, and it's not just us, it's nationwide, and it's folks that we hear from the medical examiner. It's folks that are from all walks of life. I had the opportunity recently, this was very much happenstance, to meet a forensic pathologist who was retired from the Navy. And he actually, about 1 weekend a month, flies to Clark County, Nevada, and works in Las Vegas. And he told me he goes out there and he does, the temporary work out there, and he helps them, with the low hanging fruit. He doesn't do the complex murder investigation. So he likes it. He stays out there for, I guess, a week at a time. But he told me, he said, the interesting thing about it is out there, you get people from all over the country that go to Las Vegas, and they have that credo, what happens in Vegas stays in Vegas. And he goes, some of them, he goes, for reasons he can't explain, they just want the thrill of it. They want to try it. So they go to Las Vegas, they try drugs, they buy it off the street. And he goes, sadly, he does a lot of autopsies from, engineers, teachers, people that you wouldn't imagine. And I know that happens here too. So I think the key is you got to educate people. And I know that Lakeview, you guys do that. And obviously Eric and the EMS division, and the sheriff's office and others having the Narcan. But this gentleman told me, he goes, sometimes these people are taking drugs they don't think would have opioids in them, or fentanyl. They're taking marijuana and unfortunately it's been laced, and then they end up dead. Or they're taking something that they think is MDMA or ecstasy. Boom, they take it, it's laced, it's dead. So I guess transferring back to here locally and what you're doing with LifeView, obviously we have a drug addiction issue. We've got a drug abuse issue in this community. We also have a mental health issue in the community. And recently we've opened the central receiving facility. I appreciate the open house that you guys threw and having me out there. It was fascinating to see it. So, and I think that you guys opened up late March, early April. Was that when you all opened it?
April 22nd, Jeff. I won't forget that date.
Is that when you went to Warp Speed?
It was a big day. It was a big day on campus. But yeah, we worked on the central receiving facility with all of our community partners for over a year.
Yes.
To make sure that when we opened, that we could meet the need of the community. And since we opened, we have seen, as of yesterday afternoon, we have screened 946 individuals at the receiving facility, which actually sounds like a lot, Commissioner, but it's the numbers are a little lower than we project. We continue to see increasing numbers of individuals going through the receiving facility.
Let me ask you, is that all ages, or is that just adults? Is there any juveniles mixed in?
Thank you. No, thank you for clarifying that. That is only adults.
Okay.
Baptist Hospital is the receiving facility for adolescents.
Okay. Do you have any idea of how many adolescents they've seen? Or
I do not know. They have actually, since they have the only children's beds from here to Panama City for inpatient, they started their receiving facility function almost in the beginning. It's been a year and a half, because rather than have an individual child come to a central place to then be transported for admission to the hospital, it's very seamless for our adolescents to go straight to where they may ultimately be admitted for care. So I know that they stay pretty busy in their adolescent unit. It's a little bit seasonal sometimes, so I don't know what it looks like for them today, but I know that they have been filling that role for longer than we have with the adults.
Let me ask you, on the 946 adults, do you have any kind of rough back of the envelope number of how many of those are drug related versus how many are just mental health issues, or a combination?
So the central receiving facility right now is mostly set up to establish Baker Act.
Yeah, exactly.
Yeah, Baker Act. So that would be mental health. We do some of the ex partes for Escambia County only, which is for substance abuse. So it is some percentage that have substance abuse, but if there is a Marchman Act involuntary for substance abuse, those may go to our detox facility, or may even still be going to the hospitals.
Okay.
So I don't really have the number, but I would say the majority of those individuals coming to the receiving facility are for mental health.
Mental health. And these folks are a wide variety of the spectrum, from homeless to, I mean, is it everyday people?
It is everyday people. We're starting to get the word out more to the community about our voluntary, communicating with law enforcement on involuntary has been relatively easy. So, law enforcement knows to bring any Baker Act to us for the screening. Some of our voluntary patients still may be walking into the emergency rooms at Baptist and at West Florida. So we're starting to do community education to say, come to our screening facility so that we can help get you to the right level of care. Of the almost 1,000 people that we've screened, a little over half of those people have needed admission to an inpatient bed, but the other half we've been able to connect with other community services, and a hospital stay hasn't been necessary. So many times we can connect them with outpatient services or with psychiatry services, case management. We are seeing that individuals that are coming in are more sick, more acute in their mental illness. And some of that has been just a lack of connection to community resources. Mental illness is a chronic disease like heart and everything, so you don't manage that in a hospital setting, you manage that where you live. And so community supports are very, very important for individuals with mental illness.
Let me ask you a question. Obviously, we see some of these national things that happen, and when they peel the onion all the way back to what caused it, it seems to me it always is tied in with some form of mental illness. I mean, even this latest incident that we saw a week ago Saturday. If you're a family, if you're a mother, if you're a father, and you have a son or a daughter that maybe has issues, I mean, what resources are out there? And I'd like to know if you have insurance or if you don't have insurance. So if I take a couple in District 1, they got a kid, they know has violent tendencies, he has some mental health issues, that maybe they don't have insurance, maybe he's not medicated. What resources can we bring from LifeView to help that in that circumstance?
Well, let me just comment real quick on the what I would want to dispel the misperception that everybody with a mental illness is going to do something evil, like what
we know that's not true.
In the news, right?
Sure.
The statistics actually show that individuals with mental illness are more likely to be victims of a crime than perpetrators of a crime.
Sure.
But a lot of times, like you see, even in our homeless population, what you see is just a small percentage of individuals who are living healthy lives in recovery. So I want to create that awareness, because people shouldn't be scared of an individual with a mental illness. There are bad people in the world, but certainly, mental illness, individuals who do bad things, sometimes have that connect. They just have trauma in their past. So what I usually tell people, Jeff, is for parents, for support systems, for teachers, for people around individuals, is that you're looking for changes in behavior. You're looking for, distancing from relationships and friends, and behavior that's just kind of inconsistent with how a person to be. That would indicate that maybe you need to have some conversations and see what's going on in that person's life, and what kind of support and help that they need. I know with teens, sometimes it's hard, because that's just part of growing up and being a teenager, is they go through finding themselves. But that conversation, that connection, that awareness is very important.
Well, let me ask you, one of the issues that's been identified, and I've attended a number of the task force meetings that Michelle Salzman, Representative Salzman, has run, and with great participation from the community. But one of the lingering issues seems to be availability of counselors to assist, and apparently a long wait time getting in. Some of these people, they can't wait. I mean, they're just, it seems like some of them are very, very close to maybe having an episode. Have you seen that has been ameliorated at all in our community? Is there a less of a wait time? And if not, how can the county help with that, and can we?
Yeah, so I would say the demand or the need is still far outweighing the resources in our community. And, I think that's, in my history with the organization, that's always been the case. But I think that there's more conversation happening around mental well-being right now. So maybe people aren't afraid to say, hey, I'm looking for help and I can't find it. And that's why you're hearing it more.
Right.
What I can, so resources always help. I think that there's huge and resources on the front end of situations, I think is where we have an opportunity as a community to invest. There are resources when you have a diagnosis, you get in and you see providers. Now, granted, the wait time is still a little bit long, but, we have an opportunity to help families and help natural support systems on what I look, in the industry, we talk about, the prevention end of the continuum, where if we can help families have those conversations with their loved ones, and sometimes it may be churches and pastors and just wherever that support can happen, and that one caring adult, that person who can listen and can support and provide those reassurances. That's where we have the real opportunity, I think, in this community, because a lot of that was lost during COVID, in a period of time when you are isolated and you lose those relationships, and when we all go to our computer screens and we're not around people anymore.
Right.
So we're rebuilding some of those resiliency skills in our community. And so there's opportunity there. I will tell you, Jeff, if you give me just a few seconds, because you had asked me, how do people access resources? And I just, I want to share with individuals what that might look like, because there's nothing more scary than a family, parents who know they need help for the child. They don't know how to get that help. So there's a couple different avenues that you can access resources at Lakeview Center. And this would be without regard to ability to pay. You asked me, does it matter if you have resources? We serve individuals without the ability to pay. Certainly, if you have insurance, then we work with you on how to utilize your benefits. But if you are, first and foremost, if you are in crisis and you feel like either yourself or a loved one, is a danger to themselves or others, you call law enforcement and have them help you intervene and initiate the Baker Act. That's when the receiving facility, you would come and we would do the screening and assessment. It's hard to do that, and it's a little bit of a traumatic experience. We work with law enforcement so that they are very trauma informed, but it still is a very significant event in someone's life. So if you can get an individual to come in voluntarily, you can also come into the receiving facility that way, and go through that same screening process.
Let me ask you, how often do folks do that? I mean, do you see that frequently?
We do have a lot of voluntary folks, because a lot of individuals say, I know I need help. When we very first opened the receiving facility, Jeff, I will tell you, we had a lot of voluntary, because they just didn't know where to go before. And so when they learned the receiving facility was open, then they, took advantage and came in. And
where did they go before that? The ER? Is that the only place they had?
The ER, maybe it resulted in an interaction with law enforcement. Maybe you would see them on the streets. Maybe they're bouncing around and honestly taxing their support system, their loved ones. And so, yeah, we did have a lot of folks voluntarily come in.
And when they do, are you often able to treat them on an outpatient basis, or do they have to sometimes spend some time in the facility? I know you don't have, I think you had some beds there. Tell me about how that works. If they got to stay and you got to treat them, where do they go from there?
Yeah, so about 50% of the individuals we were able to treat on an outpatient. We didn't have to do an admission. We were able to divert them to community supports. Of those who needed an inpatient admission, 60% of them actually did go into a crisis stabilization bed that we opened when we opened the receiving facility.
Yes.
So that is fortunate to have additional capacity for that crisis care, because we have certainly utilized it. We are at 20 beds right now. We are finishing construction. Eric, I can appreciate waiting on garage doors, because we were waiting on windows on one of our projects. And so we're finishing up some renovation, and we'll be at 30 beds shortly.
Do you think, and what do you run in terms of like a 90% occupancy, or is it 100%? I mean,
yeah, I mean, you're never really 100, because you have to at least have time to clean rooms and move beds, but that facility is generally pretty full.
Wow. Yeah. Well, God bless you for what you do. I mean, we're so thankful we have some resources here for some folks, because I think these things are all intertwined. I think you've got the homelessness thing here, you've got drug abuse over here, you've got the mental health, and it's great to know we're in a compassionate nation where we can provide some care. I know for a long time we didn't have this receiving facility, and I know that put a big burden on the emergency rooms for the hospitals, but I'm glad to hear it's working smoothly. What other support, I mean, what can the county do to help? I know we're helping to fund. I know you were able the first year to really get that price tag lower, but what do you think we're looking at going forward? I know there's a statutory requirement that we assist with the funding.
Right. So, I wish Wes was here so I could thank him. The funding rolling into the next year is level for the county.
Okay.
And so, we continue to be creative and ask all of our partners to participate in funding this care. I can't promise, Commissioner, that there won't be an increase in the cost at some point.
Hey, everything's going up, right? Everything's going up.
I was going to say, but at this point, we've got several new services that are launching, and we're trying to be as efficient as we can with resources while making sure that we have the right resources in place.
How about your staffing? Oh, I'm sorry, I didn't mean.
No, I was going to say it is a more medical model. So we have a lot of nurses, a lot of physicians providing care. So recruiting and onboarding that team has been, an all hands on deck. And we added 90 new team members. So it's been an all hands on deck kind of activity to make sure that we were fully staffed.
So do you have the same challenges we have with getting the appropriate personnel? I mean, do you have vacancies, I guess is the question?
We do have vacancies, but much like the county, we are seeing a deeper candidate pool. A lot more people are applying for our positions. And we have an amazing partnership with the University of West Florida in terms of creating an intern program. I have more interns now than we've had in years, because if we can create a smooth transition from the classroom to the workforce, and let individuals know what they can do in this field, and that there's so many different opportunities. They get exposure while they're still studying, and then hopefully when they graduate, they come and work for Lakeview.
No, that's fantastic. I always ask whenever I have someone on the show, on the coffee, that work in healthcare or in law, one of the things that Pensacola, as we grow and we diversify our economy, and UWF is blowing up and growing, and so is PSC. Every year, a lot of our students that graduate from high schools of Escambia County go off, obviously, to college. Some of them stay here, but then importantly, many of them have to finish off their studies, whether it be law or medicine, out of the area. And at what point in your opinion, you're in the healthcare business, you have a large organization, at what point does it make sense for Pensacola to bring some of that back? Because that's a lot of spend. I mean, that's a high dollar, $100,000, $150,000 for a 3 or 4 year degree, be it law or medical, maybe $200,000. Do we have, I guess the question is, they've got a medical school over in Mobile. I think the closest law school is not in Mobile. And speaking specifically about medical, could we have a medical school here? We have a lot. We've got a Florida State, I believe, like a satellite. But could we do that here, do you think?
So actually, a shout out to Florida West HCA and their leadership team, because they did just pass their accreditation survey to open a residency program, a psychiatric residency program. Good. And we are partnering with them to help in the requirements, because there's an outpatient component as well as inpatient. And I believe they expect to start having students come through next school year, and we will be working with 8 residents a year, which is amazing.
That's fantastic.
The studies do show that a lot of residents will end up staying in the community where they did their residency. And we could certainly utilize them in this community. So again, that's something HCA pursued, Gabe Valero, the CEO, and that team, and that would be just a fabulous pipeline for this community.
Yeah, I'd love to see UWF have a medical program. I mean, because then we could keep the students here, and that spend. I mean, selfishly, from an economic development standpoint, I mean, it's just I don't know that if we have the population to support it. But it's a question I've asked before. Law school too. I mean, a lot of our students go away to law school for 3 years, and some of them stay, and it takes them a long time to get back. I'd love to see an opportunity for them to have a law program at UWF, if that would be possible. But I always ask people in medical, because I mean, that's a 4-year degree. You could have the money, the $200,000 in tuition, could stay in Pensacola, stay in Escambia County if we could do it. But Allison, I really appreciate you being here today and getting up early. And this is, I think, the second time or third that you've been on the coffee. Thank you for what you and your team and Sean and all the folks at the Central Receiving Facility are doing for the community. You know, a lot of folks probably have no idea. I know that a lot of people have no idea the hard work that you're doing, but it's just so important. I mean, and a lot of people just don't know what to do. They don't know where to turn. And it's great that, that you and your team have answers. Is there any final thought? Is there any phone number you'd like to leave with me?
Yeah, I actually will, Commissioner. Thank you. Let me Google it, because I just have it saved in my phone. But
thank God for Google.
I know one of the resources that that I would share with folks is our mobile response team. You know, we've talked a lot about the crisis, but it's unusual for an individual to go from, you know, 0 to 60 that quickly. A lot of times individuals see signs of escalating behaviors, and we don't really want to wait until we need to Baker Act. If we can intervene earlier, then that's what we want to do. So Lakeview has a 24/7 mobile response team, and the number is 866-517-7766, which you can also find on our website, or just Google Lakeview Mobile Response. But that team is available to answer the phone, and they can respond on site, in home, at school, in the community, wherever you are. They can also do a video chat. They can do a phone conversation, again, to help you to provide some of that clinical expertise to a situation and offer advice. Sometimes their advice might be call law enforcement, come into the receiving facility. Yeah. But many times it might be, well, let's figure out how to put some protective factors in place tonight, and then in the morning, this is what we can do. So mobile response is also another great resource when individuals, and this would be children, adolescents, and adults, if the community just doesn't know what to do, can call mobile response in that moment and get some guidance and support from from a clinical professional.
No, that's an amazing resource. Is that funded? You guys obviously pay for the staff.
That's funded by the state, and thanks to our local delegation for supporting there's increased funding this year. So it looks like we'll be working with our managing entity to expand capacity and hopefully add a team. We actually cover 4 counties with that team, so it's a lot. So hopefully we can work with Northwest Florida Health and expand some of that mobile response resource.
And let me ask one final question. I spent many years on the school board. My heart's for kids and children. And I would assume that the middle schools and high schools and maybe the elementary schools, are they aware of this number? Do you know if you've worked with the superintendent and the board members?
Yeah, I would say, especially when school is in session, school is one of our largest referral sources, you know, with calls. Because again, the school is very aware too about just initiating a Baker Act. You know, I mean, it's like I said, it's not people are most vulnerable during that time. So you want to try to handle those situations with care. So a lot of times we'll get calls to mobile response, and we can provide some guidance on how to handle situations. Right
on. And again, 866-517-7766. And that's regardless. You could be a homeless transient with no insurance, and they will still come and help you.
Absolutely.
That's incredible to know. That's great to know. Well, both Eric and Allison, thank you so much for getting up early. And Eric, thank you for all you're doing in public safety. I know you're wearing multiple hats. Thank you for all your hard work, man. And Allison, thank you for what you and your team, Sean, and everyone else over there is doing. You know, I know you know this, but you can count on this board. As long as I'm around, you can count on my support, because I know the value of what you're doing, and I appreciate your time this morning.
Thank you. Yeah, Jeff, you were one of the first ones who came out in support of moving this direction. So we appreciate that.
Yeah, it's desperately needed, and more than people know. Well, you all have a great rest of the week. I appreciate y'all getting up early, and thank you for what you both do. And we will see everyone next month on our next Coffee with the Commissioner.